I'm Gregory Hanes, MD. I'm a neurologist, and I've been working here for 3 years. I'm a neurology consultant, and I'm out here about twice a month. All new patients to FINR have a neurological evaluation. I provide that. And then the patients that have ongoing neurological concerns, I see them back on an as-needed basis. It's a comprehensive history and physical from a neurology perspective. A lot of patients who have had traumatic brain injury, they have issues that are neurological like seizures. They may have ongoing imaging needs to follow to make sure that there's no additional swelling or bleeding in their brain, management of the medications, make sure that the therapy modalities are moving in the right direction. Primary neurological issues, I would be the sole individual responsible for their management, for diagnosis, for treatment, and for following the effect of the treatment. For other issues that there's some crossover between neuropsychiatry and neurology, then a lot of times I'll make recommendations for Dr. Villalba to consider whether or not to implement. There's a pretty wide range of cases that are seen here at FINR, with traumatic brain injury being obviously one of the most important, but we see strokes, we see anoxic injury, which is where the brain doesn't get enough oxygen because of a cardiac arrest or something like that, spinal cord injury, and developmental cases. They're usually the younger folks. Certainly each case is unique, and that's one of the things that makes FINR special, is because they develop a individualized plan for each patient, and the broad spectrum of neurological and psychological and rehab needs are tailored to that patient individually. Certainly the level and the comprehensiveness of the care and their ability to take care of some very challenging cases. A lot of times there are significant behavioral issues, and their ability to dedicate one, if not two people to a single individual for their safety and for their well-being is something that you can't find anywhere else. With the behavioral issues, they lose some patients lose the ability to monitor or control impulses. They also have gait abnormalities, so that they're at risk for falls. And so having close supervision is a safety issue, and also helps to make them move on the right track without getting sidelined by other things like falls or accidents and those sorts of things. I think the standard here is excellent. I've been very impressed by my ability when I come to see a patient and I want to know what's going on with, say, somebody that has a leg weakness and how their walking's going and whether the orthotic that we have is working. I literally pick up the phone and dial an extension, and I have their therapist on the phone giving me instant feedback, which is not something that I experience anywhere else. It's definitely crucial, and it's definitely better than other rehab facilities that I've worked at. The therapists all know the individuals extremely well. They're very easy to access to get information, and a lot of times it's a two-way street where the therapist is giving me suggestions for things to look at from a rehab perspective. For example, would injections of Botox be advantageous to loosen up a spastic or stiff muscle? And that will prompt me to take a look at a patient a second time, or to specifically address the therapy concerns that were raised by the therapists themselves. The relationship between the team is really fantastic. There's excellent communication between nursing staff, the doctors, and the way that we exchange information between us. A lot of times we'll pick up the phone, call the doctor, and say, hey, what were you thinking on this case? And again, the therapist prompting us to consider additional interventions. For example, Botox or bracing, and my calling the therapist to find out how they're doing and what else we could be doing to try to better their rehab. And the team is consolidated, which is really great. I mean, it's all right here. It's one unit. In the outpatient setting, it's very disjointed. You know, you have a therapy center or a rehab facility that is separate from the hospital or separate from your outpatient practice. The physicians are in separate practices, so if you want to exchange information, it's a matter of doing requests via fax, and it's much slower, much less moment to moment, and it creates a juggernaut with regard to streamlining a therapeutic program, individualized program for the patients. A lot of times when there are difficult cases, often tragic cases, and you watch those individuals and the families and how they struggle through over several years, it can be quite endearing. A lot of times when the patients come here after a severe traumatic brain injury, they are devastated. And to watch how they wake up and start to interact, and the family interaction and their excitement with even the smallest gains, and how those small gains translate to magnificent feats, you know, when it comes to functioning at home, the ability to engage in your own activities of daily living, to be able to feed yourself. It seems like a small goal to us sitting here now, but for these families, it's tremendous. So that's been one of the most rewarding things for me. The only other thing that I would stress is how unique and challenging some of these patients are with regard to the severity of the traumatic brain injury, where there's really not other reasonable options, certainly not in the region that I'm aware of, that can give the level of care and the comprehensiveness of the care. I mean, this is a real jewel here in our state, and not enough people know about it, and I'm always proud to get the word out that this place exists.